Global supply chain management encompasses planning and management of activities involved in global sourcing, procurement, conversion, and all logistic management activities so that the finished goods reach in the hand of the end customers. Now, over the years, the cost of transportation and communication have fallen, making it possible for many companies to split their production lines into different production facilities. The components and the subcomponents that go into making the finished goods are not only produced in different production facilities or factories, rather in different countries altogether. For example, a car has 1,000 number of items which are produced by hundreds of suppliers located in dozens of countries. A car may have its engine produced in Korea, its axle produced in Germany, and finally assembled in India. Now, by locating a country with lower cost of living, for cheap laborers, and a country with abundant supply of raw materials, it is possible for the company to reduce the product cost considerably to a drastic extent. Now that gives the profitability to the supply chain. But the biggest problem with the supply chain is that if one of the supply chain partner fails, the entire supply chain collapses. And that is what is visible around us due to this pandemic effect of COVID-19. We can see that entire world has almost come to a stop. Hyundai, the world's fifth largest automobile manufacturer, it has stopped its production line at the factory in South Korea because of unavailability of components from China. And this has happened not only with Hyundai but many of the automobile companies, as well as this is happening in other industries also. Now, coming back to pharmaceutical industry, which produces drugs, and there are many drugs which are highly critical. Considering the criticality of API, that is active pharmaceutical ingredient, Indian company like Granules India Limited, it has airlifted the API required for making vitamins as well as antibiotics from China after getting the permission from their government. Although the factory in China is not running, but it has got some stocks which was airlifted by Granules India Limited. In this context, I would like to take the example of hydroxychloroquine, which is used to treat malaria and rheumatoid arthritis. Now, hydroxychloroquine has come to focus because many countries are using this drug as a preventive measure to fight against COVID-19, despite inconclusive studies on its effectiveness. Now, since COVID-19 is pandemic, and many countries have put restrictions on the export. India has also put restrictions on its export of its drug hydroxychloroquine, but there was a push from US President Donald Trump to lift the restriction on export of hydroxychloroquine. Moreover, many SAARC countries, especially Nepal, has requested India to lift the restriction on the export of this drug. India finally have Government of India has talked to the pharmaceutical companies of India and have decided that it will supply hydroxychloroquine to other countries, especially Bangladesh, Bhutan, Nepal, and other countries which are highly affected by COVID-19, provided it meets its own requirement. Now, this is a very specialized export, and by indulging in such export, India has proved that it is besides the other countries in the difficult times. Since COVID-19 is pandemic, it is affecting both the supply as well as the demand side of the supply chain. We are passing through a very, very tough time. It's a global crisis, and during this crisis period, all the countries should be united together to fight against COVID-19 and so that we can restore our global supply chains. Thank you.